Hello, everybody from around the world. It's nice to see everybody. Thanks for making it out tonight and or whatever time it is. I know for some people it's like middle of the night, early morning. I don't know, all over. But yeah, thanks guys. Sorry for the delay in doing one of these Q&As. Um, but here we are. Happy New Year, first of all, 2023. It's an exciting one for myself for the practice. Hopefully, you guys are having a nice new year, and hope that you guys are healthy and your families are healthy. And that's really, as we know, the most important thing. Everything else is pretty much gravy. So we've got a few things to update you on, but let's just jump into some of these questions. So there's Diapresso Liber, who's asking about brain transplants. At first, I thought he meant body hair transplants, but then I realized, nope, brain transplants. I think before we have successful brain transplants, we'll probably be uploading our memories and thoughts to, I don't know, some sort of AI technology. The whatever iteration of Chat GPT that it will be. I don't think brain transplants are going to become commonplace anytime soon. So maybe like a digital version first. We'll see. Jesus, great. I'm glad that our videos helped you, especially within the finasteride topics. That's great. Felicia, culture around plastic surgery has changed. Do you think transparency will become more common? I do. I do. I think the younger generations of celebrities are a little bit more forward. Not everyone, of course, but it's becoming less taboo to have different types of plastic surgeries for men and women, and I think that they'll be more willing to talk about it. We want to make sure that there isn't just this increased frequency of all plastic surgeries just to do them. As we know, they have risks, and sometimes it's alarming, all the different facelifting that I'm seeing that's being done on like people in their 20s more and more, and 30s more and more frequently. So we'll see, and as I've said in some of the videos, what happens with how people heal and their complications over time that might increase if they've started these surgeries at an earlier age. We'll see. But yeah, so I have some concerns with younger people being more open about plastic surgery. But on the other hand, it's better, I think, to openly discuss it than sweep it under the rug and make believe it doesn't exist, and that it's only available for the elite. That's not good, I think, for society. All right, so Richard's asking approximate cost for a deep plane facelift. Um, so we haven't done any major announcement on this subject. We'll make a video about it eventually, but about 4 months ago, we've in my practice I've stopped offering it just because my focus now is almost entirely on hair surgery and still on lip surgery. So that strange, unusual combination of procedures. So I've let many other procedures go, surgeries that I'm good at, but that and patients, did very well, in my hands. But I can't do it all. And as this channel grows, as some of our other projects, are in the works, as you'll hear more about this evening, I just can't do it all. And so I decided to just focus my efforts and my energy, and that's just about the right decision for me, I think. I mean, we'll see. Maybe I'll come back to something, one of these other procedures, rhinoplasty facelift, one day. I don't know. But for the time being, we don't offer it. So I just refer out to colleagues. There are plenty of great facelift surgeons out there. I mean, there aren't that many really really good ones, but they're out there. So if you call our office, my office can give you a short list. That's not a list of like the only good facelift surgeons, but it's just people who I trust, who can do good work. Um, but yeah, cost wise, on the low end in like good hands, you're looking at least 25-30,000, honestly, for good work, and upwards of like 100,000. I mean, the prices for facelifting have really balloons. So yeah, it can get expensive for sure. And then of course there's like combination procedures. So if you're getting a deep plane facelift, you might be a candidate for eyelid surgery and maybe some other work, maybe even a lip lift, so brow lift. So once you're fat transfer, so once you're combining all those, it can get really pricey. Remember, these are long surgeries with risk, and but yeah, they can get expensive in experienced hands. Someone's saying fat transfer under my eyes, but only one side took. I went back and had my left eye done a second time. Unfortunately, it again didn't stay. Is this normal? Should I try again? I mean, whether or not you try again is up to you. But yeah, sure, fat transfer. There's no guarantee. We usually say about half of the fat will stick around. I mean, how long it sticks around for is not always clear, but usually for a few years, and the other half just basically, dies off. So maybe there's something on that one under eye area that for some reason is resistant to taking that fat. You can always try maybe in someone else's hands, maybe someone with a different technique. Not that your surgeon might be great, but sometimes it's helpful if something's not working repeatedly with one surgeon to maybe try the same procedure with somebody else, and that can happen sometimes, and that could help. Um, Someone's asking, let's see, Australia Sue, could you please explain if the level of facial sag or underlying bone structure mostly determines whether a SMAS plication overlap or a SMASectomy is used? It's not so much. The level of sag, it's honestly a surgeon preference for the most part. I should say, surgeons who perform deep plane facelifts do that pretty much on everybody. Some will still do some SMAS only work and not do the deep plane. There's like lots of variations. We have a video on facelifts in different styles, so definitely check that out. But yeah, I mean, the way I see it is that the only reason to do true deep plane is when the mid face has also a good amount of sag to it. But honestly, most people who have sag in the lower face also have some mid face sag as well. So that's why releasing all that together is very helpful. And so that's the deep plane approach. Some doctors don't do deep plane surgery, and that's okay too. They still can get great results just manipulating the SMAS. And so then you decide, do you want to plicate the SMAS, imbricate it, cut a portion out? There's different variations, and they don't necessarily make huge differences, to be honest. But the deep plane is a more extensive release, and especially in getting the mid face up and moving. Okay, I always get caught up at the top with questions, and then I know you guys are typing away, so I appreciate all the comments. So without further ado, let me just start with our first point, and then I'll come back to the questions. So we have, as I mentioned in I think the last Q&A, we have some products that we're going to be coming out with, and these aren't like we for fun we did like the sweatshirts, the feel confident sweatshirts, or I feel beautiful sweatshirts, and that was fun. Um, but we weren't really going to expand the merch line for a while. I mean, that's we always wanted to do something a little bit more, I would say, like profound. So the first product is going to be a scar gel. So we're going to have like our new brand is called Feel Confident. It's going to have two branches, a skin care side and a hair care side. So for skin, we're going to start with a scar gel that like we custom formulated over a year ago with a really good chemist from scratch. We've tried it on many people and made sure that it had the right qualities that we were looking for in a scar gel. So that will hopefully be out next month, which is exciting, finally. And we have a hair care line. So we're starting with some prescription medications first, and then we have our own like shampoo conditioner that we've developed as well. And so the prescription medications hopefully will also be available next month, and it'll be cheaper than the competition and all that because in our opinion we need to bring you guys value, not just you guys, but whoever is interested in this kind of stuff. And the only way to bring value with generic medications is to drop the price. So that's what we've done with those. If you guys want to hear about like the latest when it comes to our products, We have a mailing list that we, like a prompt that we put together. You have to go to signup.feelconfident.com. The Feel Confident website is still being built and connected to all the other things that it needs to be connected to. And it's in the description of this video. And then I think Marco is going to put a link to it as well. So go there, put in your email address. So this way, when we have the products ready to go, at least as they come out, because it's not like there's going to be 50 products at once. It's like a gradual rollout. Some will be Q1 of this year, others will be Q2 and later. So we have different skin products, different hair products, but all with a lot of, I would say, thought and attention, as you guys have, I think, come to expect from us. So that's exciting. I'll go back to some of these questions. Let's see. How do you feel having to work with insecure people the rest of your life? I get you're changing lives. It's just most issues these patients have are due to low self-esteem. My thought is simple. I think we all, at one point or another, have low self-esteem, and for some people, it like permeates their life since they're very little, and it basically never changes. And some of those people get on medications, and others get surgeries to try to improve their state. So there are like I would say more extreme situations where people have just like really kind of like a low kind of I don't know, opinion of themselves, low self-esteem, whatever you want to call it, low confidence, and they turn to medications, therapy, different things to kind of get them through life. So you have people like that, some on the extreme form, and some less extreme. But I would argue that all of us at one point or another need some sort of uplifting, and sometimes it's just emotional, and sometimes it could be with medications, and sometimes it could be surgical, and that could be because you had a change in work that is very stressful, or somebody at work is really problematic, but you don't see a way out and need help. Other times it could be like a disease that you were diagnosed with, like someone healthy being diagnosed all of a sudden with a cancer is not going to be, I mean, it would be really strange if they weren't psychologically affected by that, or the death of a loved one, or being dumped by someone who they thought loved them, right? So there's lots of different life events. So, I mean, I hear this person with this question, I understand where they're coming from. And of course, in our field, we have to be very sensitive to people's emotions, when it comes to plastic surgery. But most people are very normal patients who come to me, and they have something that has been bugging them. And usually, when we address that thing, they feel much better. They go about their lives, feeling just better about themselves. And yeah, I mean, could you make the argument that, oh, if they just had some therapy, they'd be fine? I don't think that always holds up, because sometimes there is like a very physical thing, and people around them are responding to that physical thing. And sometimes it's better to address it, I think, with surgery than to just put people on medications for like depression or anxiety or whatever. So it depends on the scenario. It's a very nuanced thing. I mean, I appreciate the comment. But yeah, I mean, I think all of us at one point or another have insecurities, so there's nothing strange about that. All right, so someone wrote here, Nusherwan, thanks for your videos. If minoxidil is started, does one typically lose the effects in a couple of years? That's what I've heard anecdotally. Well, it's not that you lose the effect. There's lots of kind of things to unpack here. So minoxidil, remember, it's going to increase the anagen phase of the hair, right? So the hair cycle, and so the hairs are going to like appear fuller, and to some degree, it'll look like maybe have some more density in certain areas. Now, uh, if you first of all, when you start minoxidil, usually there's a shedding phase because it kind of accelerates the hair through the hair cycle. And so that's nothing to be alarmed about. Usually it goes away after a few weeks. Once you get on the minoxidil, there is a plateau. It's not like your hair keeps getting fuller and fuller and fuller. No, like you do reach a plateau and then usually you ride it out, assuming you're taking the medication. Now, let's say you're taking minoxidil, but you're not taking finasteride, you will continue, like, right, there's nothing preventative, truly preventative there, because finasteride is the more preventative medication. So you will continue to thin out then over time, most likely. Minoxidil will still be somewhat helpful, but it can't do the job of, say, finasteride, right? So there's different ways to kind of approach that question. If you've been on topical minoxidil like Rogaine and decide to have a hair transplant, I'm guessing you switch away from the topical form to a pill. Well, usually you hold the topical for like 2 weeks, and then you can resume it after the hair transplant. In general, I switch many patients from topical to oral from minoxidil because it's more effective and still very safe. So, regardless of whether or not they're having a hair transplant, most patients who are coming to me are getting at least offered oral minoxidil unless they have some cardiovascular issues, but most are, don't have that problem. So yeah, yeah, you don't have to switch to oral minoxidil just because you had a hair transplant. You can continue on topical, but just maybe give it like 2 weeks after the transplant, because minoxidil has it's like alcohol based, so it can be irritating for like kind of fresh wounds, which is what you have after surgery. All right. So let me also tell you guys. So I basically already said this, but the Feel Confident brand will hopefully launch next month, and it'll have its own dedicated website. It'll have a rollout of some initial products, and we're gonna love to get your guys' feedback, and you'll have to tell us what you think of the products, of just the whole design and the concept of it, and then there'll be more products coming out in the future. Each product, as I've learned now, takes a long time, unless you just like take someone else's product and like white label it, like stick your label on it, and obviously the prescriptions are not like our own, right? I mean, that's just coming from a pharmacy, uh, but we've at least worked out the pricing so that we think it's as fair as it can be for people. But even like the logistics of getting it all set up with like a digital pharmacy and a whole company that has doctors with licenses throughout the country to prescribe these medications, because I'm not going to be the one prescribing, for this other separate brand. That took time to like set up. So, and it's still being finalized. So all that, we're doing from scratch. Like no one's like, we don't have venture capitalists and people telling us, how this stuff has to get done. So we're just learning along the way, but making sure that whatever products we actually formulate and are putting out there are as good as they can be and as safe as they can be too. So we're putting them through all the testing, all that proper stuff. We're not rushing into it. Cool. And let's keep going here. And let's see here. Thank you guys, by the way, for joining us. Sorry, what happens is like I'm trying to scroll, and then all of a sudden it just like sends me all the way to the bottom of this thing. But here, I'll just try to jump around a little bit. What's the best for a sunken face and protruding mouth? Would braces work? Uh, I have to see like a picture of exactly what they mean. I mean, there's different treatments for sunken face. That not sure what they're referring to there. Some people, when they say sunken face, it might be an orthognathic issue where like the whole upper or lower jaw is like recessed back, and a person like that might benefit from oral surgery, not just for cosmetic reasons, but also for functional purposes to preserve their teeth. So I have to kind of see photos to understand what they're getting at here. And someone asked about choosing a breast surgeon after breast cancer treatment. I mean, yeah, I don't that's not my area, but as far as general tips go, I think it's a question of like some people want to just go to the best, right? And they'll be willing to travel to wherever to find like the best surgeon, whatever that means. And other people just want to stay local. So I think it depends. Like, I think Google is great for searching for like local folks, because they give mostly like hyper local, information. I think if you're going to search for like best just in the world, you have to sort of ask around. You have to search who's giving talks at conferences, who is out there, putting out really great work, whether it's on Instagram or YouTube or whatever, but like see people's before and afters and, feel comfortable with them. And then there's a question of like, if you can get insurance, because this looks like a reconstructive surgery after breast cancer treatment. So many people would want insurance to cover that. So then it's like you have to figure out, will your insurance cover, or which doctors they'll cover. So there's like lots of elements here, and it's not totally straightforward. But yeah, there's different ways to approach it. You want to look at reviews. You want to look at before and afters. You want to interview, the surgeons, talk to them. Don't just like say, okay, this is the person. Talk to a few of them before deciding. Someone wrote here a lot of minoxidil questions. So Michael writes 2,200 FUE grafts in Australia 5 months ago. Loving the results. Cool. Awesome. Glad you're happy. That's good. All right. What do you think of hair follicle freezing banks to help prevent baldness in the future? So we have a video on that. So search for it. And I think there's like we put hair cloning into the title, but it's for these types of banks. And basically the summary of that video is I don't really see a purpose to it now. What some hair transplant surgeons are doing is they'll like do your transplant, or even without a transplant, they'll basically offer to do this type of extraction of just like 50 grafts or whatever, and then they'll like store it right with some company, and the company might do research on your follicles. They might eventually be able to like clone them. But here's where it doesn't make a ton of sense to me. Uh, the hair is coming from your, just like donor area, right? The hair that generally will be with you for the rest of your life, theoretically, right? And so for most people, if they just go bald, they're left with like that horseshoe of hair, for guys. And that hair will almost always be there to some extent. And so my thinking is you can always harvest those grafts later on once we're closer to being able to clone hair, if we get there. And that would be appropriate. I don't really see why taking those hairs out now just to have something in the bank, because most people, unless they have like my condition, don't just lose all of their hair. That would be very unusual. And even like in my condition, right? Even if I saved some hair before I lost all of it, and it was like frozen, and then one day we had cloning and they cloned my little hairs, putting it back into my head wouldn't really make sense because my immune system would still reject them. So, right, because it's an autoimmune condition. See, I don't really see, other than like a money grab up front. Uh, I'm not really sure what the purpose is, and if it's just to like do research, well, I don't know. I think they should be paying whoever is donating for those graphs. Like if they're going to be doing research on them, right? You shouldn't have to pay if they're going to do research on your graphs. That's my thinking. So yeah, but it's a good question. So let me also tell you guys that so I bought a new space for my practice. I've been in like a kind of a shared medical space since I started the practice, and it's really nice and it works, kind of like a medical WeWork of sorts, but nice. It was brand new when I moved in. And it was just time to spread our wings and have our own dedicated space that's just for our patients, with our own like procedure rooms, kind of OR, all that. And so it got a place about like 4 or 5 months ago, like 4 blocks from where I am right now. So we're not going to be far. It's all in Manhattan, and it took forever to get through the board. Like it's a condo building and there's a board, right? These people who make decisions on, who can move in and can you do renovations, and they put up a lot of barriers for our construction plans. And so finally, they approved the plans about like 3 weeks ago or about a month ago. And then now we're going through the Department of Buildings to try to get their approval. That's like the local, local government to for them to bless it. And so then we'll be able to start a demolition and then start building. And we're really excited about it. So do you guys want to see a series on YouTube about how we're like building out the space? And it'll be a pretty, I think, awesome before and after. But really like, incrementally as it comes together. If you want to see that, let us know in the comments and we'll review that. So that'll be fun, I think. I think it'll be fun. Maybe you guys think it'll be boring, but we'll see. All right. Let's see. What else? Let's see. What's the best? Eyebrows are looking great. Thanks, Lorraine. Appreciate that. All right. Let me keep going. Robot and dolphins. I don't know what that means. And Rachel's asking, what makes a good theater nurse? Love your vids. Thanks. Yeah, by theater, I think she's referring to like the operating room. And I think in some countries it's referred to as theaters, like operating theaters. Uh, we call it just like OR, like an OR nurse. And, a good OR nurse, someone who isn't, you know, afraid of like blood, right? I mean, you have to be like ready for the elements. Someone who is just able to think on their feet and quickly adapt because surgery can be unpredictable at times, and so you want a nurse who's like really able to be flexible and not super stuck in his or her ways and not able to adapt to the scenario. So I think that's super like important, and just someone who's like helpful and just down for like whatever is needed in that moment to like help the surgeon, help the team, the anesthesiologist, whoever needs it. So that I think is those are some of the important traits. We've got someone who's popped up here in the chat. 54-year-old male, weightlifter in good shape, but a few deep lines in the neck. Look bad. Any good procedures to fix the neck? No, I don't like to use terminology like fixing. I like to think of it as like improving the situation. So deep lines in the neck can be a challenge if Justin, I guess is his name, if Justin potentially qualifies for a facelift just based on kind of sagging of tissue. I don't see his pictures that well, so it's hard to tell. If there's jowling, if there's kind of laxity in the neck, then sometimes a facelift is the way to improve it. Other times, it's non-surgical things that might help. So occasionally, if it's just a deep line, filler into the line might be beneficial. Sometimes a radio frequency tightening device like FaceTite can also be helpful. I wouldn't look to these things to like fix it, but it can soften the area and improve it. Even like Sculptra to rebuild the collagen can help for situations like that. Let me see if he has a follow up. Oh, 44-year-old. That's okay. The recommendations are still pretty much the same. So hopefully that was helpful. All right, so let's keep going on. Is 18 too young for finasteride? I don't know. Not necessarily. It just depends. Like some 18-year-olds are almost bald. So if you're in that cohort that has like accelerated hair loss and you're young, you definitely have to first of all understand the side effects, potential side effects of finasteride. But I think the individual needs to decide if they're, willing to take on those risks, to potentially save their hair. Because sometimes it goes quick, There's some people 18, 19, they've almost lost it all from male pattern hair loss, but just an accelerated form of it. So yeah, just something to consider. So I don't think no 18-year-old should go on finasteride. Yeah, there's some who could benefit. I think if you have like a full head of hair, there's no signs of any hair loss. That's overkill, obviously, to just start that preventatively. But if there's some early signs of some hair-related issues. That might be a consideration. Ryan writes, "Thanks for being a real one, Dr. Linkov. No problem. Where are the top 3 places to get a hair transplant?" I don't it's tricky to like throw out names, because I don't want to first of all, it's a surgery that we do a lot of now, right? So I can confidently say that we're doing A plus work, top notch. I don't think there's a clinic out there that's better than us. I think there are clinics, of course, on par. Um, but, especially when you're thinking about price, it gets tricky. I think the clinics that, have proven to be, at least in like Europe and the States, it's it depends, right? There's a lot of variations, but places that are kind of proven to be good places, their price tends to go up and kind of be at the higher end of things. So it's hard to always know, like, maybe you can find a place that's a lot more affordable that still can give you a great result. And so, I don't have like all these places just ready to spit out for you, but so this actually leads into something else I wanted to tell you guys, which is mentioned it in the past, but we're working on an AI type of software, which is made actually, but we're building an app around it. It's basically for predicting hair transplant results. We had a very, very, very early beta that we put out on YouTube, just without the app like element of it, but it was really just the machine learning component. And so some of you guys who tried it out, thank you for the feedback. I think you'll be impressed by the 2.0 3.0 by now version of it, and we'll roll that out at some point this year, maybe Q2, we don't know yet, but that'll be exciting because it's not just like machine learning, that component of it, but it's also going to try to create like almost like a social network for people interested in hair transplants and connecting people. I'm not just trying to send everyone to my clinic because we're busy enough. We're basically going to have clinics from around the world in this app, and we're going to use more or less the ISHRS uh, directory to start things off, and then we'll see how we optimize things beyond that. But that will give, I think, people a sense, and so clinics can eventually go in and input their pricing and maybe some before and after pictures. So we'll see, but I think it'll be a cool thing, and then there'll be like a forum where people can post their predictions or their actual transplant results, and then others can give some feedback and pointers and whatever. So that is something that we're working on actively. And so I think for like Ryan's question, I think there'll be more information, to find a place where you feel comfortable based on pricing, based on quality, and all of that. So that's all coming this year, which is exciting. Are you actually bald or is it a mask? Nope, just nothing to. There's nothing to take off. My daughter likes to say, like, what did she say, Liz, about me being a coconut? I don't know. She calls me a coconut, and like, she comes over and hits me, cracking the. Yeah, she says she's constantly like hitting me on the head and saying that she's cracking a coconut. So the answer to the question, techno utopia. This is not a mask. I have alopecia universalis, but I've had some spontaneous regrowth of the eyebrows. Used to not have eyebrows. Eyelashes are more or less back. I've got some beard hairs, some hair on the side here, that's coming back. So yeah, pretty cool. Good. So, can you get an FUT scar covered with FUE and still have some planted on the top of the head all in one session? That's a good question, Brian. So, we definitely do the FUE into the FUT scar surgery, but I don't like to combine it with work like, let's say, on the frontal scalp, because it's like technically just challenging because you have to have someone face down to do the work on the back, but then to do the work here, they're laying back. And so, it's too high risk for, and it's a fairly angled placement for the FUT scar. So it's just a very difficult logistical problem to solve. So my preference is to separate out those surgeries, do a procedure dedicated to the scar, and then separately work on the frontal scalp. Now, what I tell people is like the scar will consume some grafts, usually at least like 400 or 500 minimum, can be up to 800, 1,000 into the scar. Those are grafts that could be invested in the front and give a much more substantial result to the frontal scalp, for example. So you really have to decide how to properly invest your grafts. And sometimes putting them into the FUT scar isn't the best solution, but it's a case by case based situation and decision making. I also wanted to mention that we are working on a hair transplant competition. So we realize that at least our current pricing is not for everybody, and that's unfortunate because obviously I want to treat all people if I could. I'm one person, but later on in the future, maybe I'll bring some other docs under the practice and we'll be able to have like lower fees and stuff. But I have really good help in the office, so like not just my front desks people who are also excellent, but my actual like technical help is really top notch. So to keep really good people, the cost is there. And of course, like this is now mainly what I'm doing, so I'm not doing other surgeries that you know could have been also like my bread and butter, but now it's mostly hair. So we definitely you know I think charge on the higher end of things for hair surgery. And what that means is like it leaves people who want to get quality surgery, but don't want to travel, let's say, to places where they could potentially get an affordable surgery that's high quality. It leaves them with fewer options, right? Because some of the local options, let's say in the States or specifically in New York City, if the price is low, usually there's a reason for that, and maybe you're not getting the best quality. And so we wanted to cater, at least initially, to patients like that, but we wanted to create like something fun also for the YouTube community. So we have this like competition that we're doing. We're vetting people who we need them to be actual good candidates for a hair transplant, and then bringing some of them into this like little mini competition, like think like Mr. Beast but like on a smaller, more professional level. And so once we have someone selected, we'll offer them essentially a free hair transplant, and they'll that person would have to be open to being recorded and for people to see what their experience is like and all of that. So that's coming. Hopefully we'll have the competition in February or March. We've already selected 3 people. We're looking for 3 more, but like we're pretty much almost done selecting those. So that is coming. Um, Someone asks here, Abjazed, I'm getting a hair transplant in less than 2 weeks. Worried about the potential of keloids. I've had trouble with them in the past on my chest, back, and neck. Thoughts? So, yes, of course, if you've had keloids in the past, there's always a risk of having a keloid, let's say, in the occipital scalp, which is, I think, where he's most worried about them. But surprisingly, the occipital scalp is fairly protective when it comes to keloid formation. It's not a common place for them. It's more common in the areas that he's described. And so, one option for a situation like that is to do a smaller test procedure where you might harvest, let's say, 15, 20, 30 grafts from a specific area and transplant those just mainly for the donor so you can see what it's like, with the healing. So that is an option before doing a bigger procedure where you're now doing thousands of grafts. And then, of course, I would caution against a FUT scar because that obviously will increase your risk for like just the worst scar, compared to FUE. Sorry, thirsty. So someone wrote here, FUE in 2 weeks, doc using micrometer 0.7 to 0.9 millimeter. Why do you still prefer manual I guess graft extraction? Minimal scarring is my top priority. Need 3,000 I keep writing drafts, but I think they mean graphs. Uh, and I think by the micrometers, I think they mean millimeters, and a zero point 0.7 to zero point 0.9 punch is what, like, I'm trying to just interpret this comment that isn't fully written out. So, why do you still prefer manual? So, lots. I'm not really sure what their question is, but the punch size, you know, it's interesting. When I started doing FUE, we were using like 0.85, at least in my training and when I first, was doing the stuff, 0.85 millimeter punches. And now for most patients, we're using 0.95 millimeter punches. So there's a way, I think, with the right device, and it is manual in a sense. You're using your hand, but there is like an automatic. There's like a motorized, unit that we use. We don't like the robot, and I have a whole video on why I don't like the robot. But these are motorized devices that most of us are using, but they're like handheld, right? So I think you need a punch size that's large enough to capture your 3 and 4 hair grafts reliably and consistently, right? Because remember, there's sometimes splay in the grafts. So like at the root, they'll splay. So if you use a small, really small punch, like a 0.885, you can sometimes like lose some of your graft, some of your hairs, follicles within the graft because of that splay. So you need it large enough to collect the full follicle, right? So that you get your graft nice and healthy. And you don't want it so big that you leave large holes behind from the scarring. Like this patient's saying, he wants to minimize scarring, as of course everyone does. But on the other hand, you want a result that you'll be happy with. And if most of the grafts that you're transplanting are ones and twos, you're going to have a much kind of thinner sort of looking result, less dense result than if you're bringing over your heavier grafts. So it's a balancing act, and we found, at least with the WA punch, which is what we use, 0.95 works great, good scarring, and nice results for transplants. Sometimes we'll go up to a 1.0 if it's like really curly hair. But talk to your doctor about that. They should be able to explain all that to you. Is there any benefit to microneedling after switching to oral minoxidil? There could be, yeah. I mean, microneedling is going to still bring in, it's going to increase your blood supply to the area, bring in, more blood, which is going to usually help with promoting hair growth. So those can work synergistically. It's just, I see it as just an extra form of medical therapy. So there could be benefit to that. And a lot of questions coming in now. I have a scalp issue. The left side is very wrinkly, like a brain. I power lift and see a lot of guys with the same thing. Any idea what it is? There is a condition. Um, it's something that some people um, have where you get these extra folds in the scalp. And try and get you the exact name. It's cutis verticus gyrata, right? You get these convoluted folds, deep furrows of skin that resemble the surface of the brain. And one way to treat that is to actually go in and excise some of the excess tissue so that there's less redundancy in it. And that can give a smoother appearance. So that is that condition. So what else? What else? Let me move away from these chats at the top and we'll keep going with the questions. All right. Sorry, lots of different questions coming in. We'll probably give this another 5 minutes or so. Let's see. So I think I've run through my whole list for you guys, and not a hair question. Eye hollowing is so annoying. What type of filler do you recommend, or is surgery the way to go? Well, Mike, generally speaking, if you just, and I have the hollowness under the eyes, and that's why people are like, oh, he looks tired, and it's annoying, but it's not the end of the world. But like if you have it and it bothers you, filler is sometimes an option. You have to make sure that you don't have pseudo herniation of fat, because if you have herniation of fat and you're putting filler in, you're just going to be chasing that fat that's pooching out, and you're going to get too much filler underneath, and it's going to look like swollen and not great. If it's a true hollow and you're putting in some filler, I would usually go with the Restylane L type of product. These days, I don't inject. In my practice, I have a nurse injector, but Restylane L is what we usually recommend. It's like middle of the road as far as G prime when it comes to filler composition. And so that's an idea. Other options, yeah, lower blepharoplasty is usually a nice option in good hands to sometimes even reposition some of the internal fat over this infraorbital rim, and that can really smooth out the area as well, and sometimes even a fat transfer to the under eye. So different options for the under eye area, but I would see, like, honestly, an ocular plastic surgeon who has a lot of experience with under eye surgery, who also can offer sometimes filler for the right candidate. That's probably the most, advanced type of provider to see for that. That jeweler guy is asking, as a non-viable transplant patient, I want to say thanks for all the info. No problem. I've been rocking a bald head since 10 years ago. I appreciated knowing I likely wasn't viable prior to finding out. Yeah, yeah, good. Yeah, no, I think, listen, I think this information is hopefully interesting to most people, even if they're not like looking into getting surgery. I think it's just something different that most people don't like learn about or have easy access to information on. So, we're just doing our thing here, educating, and if it like helps people figure out that they want surgery and they go and find a doctor, great. If they decide, like, actually, now that I've heard him say this, I don't want to have the surgery because it's too risky, or it's not going to give me the results that I'm looking for, then I consider that a win as well. So that makes me feel just as good. Happy MLK Day, everyone. Yes, yes, same to you, Thomas. Thank you for bringing that up. That's important. Uh, what else? Current waiting time for a consultation. In my practice, I think we're booking into June or so right now, and we do have like an expedited option, but just call the office. They'll tell you all the details about that. And we're only currently scheduling for hair surgery, so that includes surgical hairline advancements, eyebrow, beard, hair transplant, of course, the usual kind of scalp work for men and women, for everyone, for hair. And then for lip surgery, so cosmetic lip surgery, usually that means lip lifts, sometimes lip reductions, corner lip lifts, things like that. But I'm not scheduling for anything else at this time. And yes, thank you for liking this chat. That helps out the video. So thanks everyone for that. And just so good to see everybody. Kind of wish I can meet more of you guys in person one day. Maybe that'll be possible. Marina, I didn't know you went live too, Doc. I'll watch the replay. Um, sure. Yeah, why not? Live is fun. Why are people so bothered by those that have surgeries to feel better? Have they heard of freedom? Yeah, it's a good way to put it. Yes. Yeah, I mean, look, I think as long as people are properly informed and educated on a topic, and choosing providers who have some skill, who have, who care, who, have the right approach, and are not just like doing it for money or whatever, then usually, like, the satisfaction rates are quite high in aesthetic surgery. But when there's like a mismatch there, when the patient's not really a good candidate, when the doctor, isn't the right fit for the patient, then you get some situations where, people are not as happy. But it's not like, also keep in mind, like, surgery is not always, you're not always going to get that A+ result from like the beginning. Also, like, like there, like, revision surgery is part and parcel with plastic surgery. Like, there's going to be a percentage of like revision cases, and in hair, I think what's nice about hair transplants is it's almost like a different culture to a degree. The concept of revision work in hair transplant usually refers to work that's just done poorly, like you have like really bad strategy, like with where you place a hairline, or the way that the hairs are angled, or the direction is like really off. So that leads to repair work. So that I think we consider more revision in hair. Um, but what isn't necessarily a revision, but more kind of like a touch up or a secondary surgery is if you just didn't get the density that you were hoping for. You could have really great survival of grafts and still feel like, hey, it's just not as dense as I was hoping. So that is a situation where you just need more grafts and you need more surgery, and so that's just some things. But in other types of procedures, I think all too often we think of something as like a failure, like if you had a facelift and it's not tight, 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 but like a big improvement on what you had before, some people will see that, oh, it's like a failure. But no, it's like the doctor did their best to give you the best possible result. Maybe, eventually you'll need an additional sort of lift and a tightening, but that doesn't mean that the initial surgery was necessarily faulty. Not to, kind of just protect the surgeons in this, but that is, I think, an important consideration. Is I just don't want patients going into things and thinking that as long as they pick the right, the best surgeon, that they're always going to get like the best result. Like, every person is different, everybody's face is different, and it will react differently to the same named surgery, right? So it's just like super important to keep in mind. It's not, sometimes it is bad work. Sometimes the planning was bad, the execution was bad. Plenty of work is done in that light, which is sad. But assuming you're going to like a good person in that specialty, just kind of have an open mind to the possibilities, like the different like outcome possibilities, right? It's not always going to be exactly what you envisioned it to be, but it will hopefully be an improvement on what you had. And you can always do something additional to improve it further. So I think that's the proper state of mind if you're getting cosmetic surgery. Someone asked here, probably one of the last questions that I'll take. I'll take Bob's question and then one other one that I find in this chat. My hair was very long and curly, but I cut it short. Now I'm growing it out again, but now it's straight. What happened? Can I get it curly again? Um, Yeah, I mean, I think, there you can go to, like a different salon, like a salons, I think can make it, more, curly. I'm not sure exactly what happened. Doesn't sound like you need surgery, but it sounds like, maybe at a salon they can, help give you like a certain type of treatment to your hair to make it maybe a bit more curly. That'll likely give you some improvement. Now, it might still continue to grow straighter from its root, but you can do some sort of a treatment, I'm sure, to make it appear more curly. So okay, so let's just take one more here. Mm, I'm searching, guys. I'm gonna go all the way down to more recent stuff. Okay. Alec asks, why would one choose finasteride over dutasteride? So this was actually covered in our video on finasteride, and the reason is finasteride has about half the incidence of side effects, sexual side effects, and other side effects compared to dutasteride. So dutasteride is definitely more potent. It's more effective at preventing further hair loss, but it almost doubles your side effect profile. So for many people, they're worried about these side effects, because they're real in like 2 to whatever 4% of patients for just finasteride. So now if you tell them, "Oh, take dutasteride," and you're gonna be doubling the possibility that you'll get these side effects, most people will be pretty bothered by that. And then even in my practice, when I look at the pros and cons, sometimes I feel like the potential downsides of dutasteride will outweigh their potential benefits. But again, I realize that everyone has to make that decision for themselves. But as a provider and as someone who's prescribing a pill, like I'm still responsible. So I don't personally prescribe dutasteride, but I know many people who do. There are specific scenarios where I'd consider prescribing dutasteride, but I don't prescribe it most of the time because of that increased side effect risk. Okay, Dark Angel had a question, and this will be the last one. I'm a transgender woman living in Paris. In 1 month, I'm going to have my FFS. Just wanted your opinion on frontal bossing and brow bone shaving, scalp advancement, brow lift on the same day. Uh, I don't do the brow bone shaving. It's just not part of my practice. I do scalp advancements with or without brow lifting. And I think that can all be done at once. Um, that sometimes a scar, heals just okay. And you might consider getting a hair transplant into the scar down the road. I had a patient who we did also like kind of feminizing procedure to lower the hairline with transplants, and we did that. And then she went on to get the brow bone shave, and they went right through the transplants, and it was like maybe only 6 months after our surgery, and I didn't know that she was getting that surgery. She never told us. So then of course, that impacted the survival of the grafts that we placed. So then we had to come back later on and transplant into that scar. Now, what I'll say, and we have a video that I already filmed about transplanting hair into scars, and that will be coming out, I don't know, within the next few weeks. And that's an interesting video because the scars are not all the same, and hair will survive in general in scars, but it'll survive better into well vascularized scars that are thinner and less like deep and wide. So scars that are deep and wide and have low vascularity will not support graphs very well. And so there's lots of variability with graft survival in different scars. And so what I'd say to you, Dark Angel, is to make sure that that scar is as optimized as they can get it. And sometimes that means not having as much advancement of the scalp as maybe you want to have, because some patients, they might benefit from 4 centimeters of lowering, but 4 centimeters of lowering is going to create a lot of tension on the scar, on the closure, and that's going to lead to a wider scar. And a wider scar is, not going to allow for hair to grow through it, both in healing, but also if you were to do a hair transplant. So, some considerations for you as you plan out that surgery. Guys, it's been real. Thank you for joining. This stuff always it flies by. It's like I could keep going, but I've got surgeries tomorrow, three of them, three lip surgeries, and I have to be fresh. So I will say good night now. Hopefully, you guys got all the information. So to recap some of the points that I introduced throughout this Q&A, got the product mailing list. So go to signup.feelconfident.com so you can get the latest information on our products as they come out. And initial products will be some prescriptions for hair and a really good scar gel for more like, any scars. And then we have the website for the brand, which is Feel Confident, will hopefully launch next month. So stay tuned for that, feelconfident.com. We've got the new space, and I want to know, we'll sift through these comments later on to see if you guys want like a series on how, the new space gets built out and just the progress. Listen, it's Manhattan sized, so it is it's not, don't expect some massive space, but it will be very nice, and it will house the practice for years to come, I think. So that'll be good. And then we have the AI machine learning app for predicting hair transplant results that will hopefully be out later this year. It'll definitely be out later this year. We just don't know exactly when. And we'll have like another beta testing that we'll invite you guys to try out. And again, we want to build like a social sort of space for hair, so people don't have to rely on like archaic forums or subreddits, but like a dedicated kind of place where they can get like a useful, um, machine learning element, but also interact with others, and then also hopefully interact with clinics, right? We're trying to pair people from around the world with like reputable hair clinics. So that's great. And then the competition for a free hair transplant, that's coming up, and that'll be exciting. We're really trying to vet people carefully who are candidates, and also hopefully have like an interesting story to tell. And I think it'll be fun to watch, and that will be pretty cool. So yeah, so that's about it. Have a great 2023. I'll be back at some point. Once the Scar gel is out, we're gonna do like a custom signing. So meaning like we'll have these like thank you cards, and we'll sign people's names who like, whatever, get like the first 100, 200, 300, whatever it ends up being, Scar gel bottles. So that will be a fun. We'll do it live, and I'll sign your name, and then we'll ship that with your Scar gel to you. So that will be fun. Um, so that will hopefully take place in February. So I'm super excited about that. So see you guys soon, and stay safe. Have a good rest of the day. Talk to you guys. Thank you so much, by the way, for the support on the channel. We're getting closer to 500K, which is cool, and we're hoping for a million in 2023. But just a testament to all of your support, and like watching our videos, and commenting, and a lot of the videos that we do now, the ideas are generated from the comments that you guys post. So keep doing that. That's really helpful for us. We're going to keep trying to innovate, in the hair space, in the aesthetic surgery space. We have a secondary channel. If you guys don't know about it already, it's just City Facial Plastics, and Nurse Nikki is like the face of that channel, and it's mainly focused on non-surgical, like facial, and there'll be some body like aesthetic procedures that are non-surgical. But I love her approach. She's really good, as a like a technician, like as a provider, as a nurse injector. But beyond that, I think she has like a really strong like moral compass, and cares about the same types of quality that I do, and that we all should. So so subscribe to that channel too, so you can get Nikki's videos as well. And it's not going to be so much hair. Maybe eventually we'll do some non-surgical hair videos there. I don't know, but yeah, and we're so yeah, so lots of things in the works, but we'll keep in touch. You guys take care. Thanks again for joining, and we'll talk soon. See ya.